Government plans to ramp up its vaccination drive and open more sites to reach a bigger part of the population. Acting Health Minister Mmamoloko Kubayi has warned although infection numbers are going down, especially in Gauteng, the country is not out of the woods yet. The province has been the epicenter of the third wave. eNCA's Heidi Giokos has been following the vaccination program and joins us now live. So Heidi, what we know about last week is that violence impacted on the vaccination drive. There are some doses that have also been affected. How is government ramping up its vaccination plan?
Speaking of those doses, Clement, we do understand that 47,500 COVID-19 vaccines were destroyed, demolished or looted, whatever you want to call it, during the looting and unrest that the country went through a week or so ago. And of course this is going to have a significant impact. Many people might say it's not that many vaccines, but it's 47,500 vaccines less that we could have been administering. We also understand that about 120 pharmacies were looted, destroyed, and some were even burnt down completely because of the unrest and looting. It's not only COVID-19 vaccines that were impacted, but other chronic and critical medication was also looted and taken. And the Department of Health saying that this is a huge concern for them and nobody should buy medication from anybody else other than a licensed pharmacy or a doctor. But we do know that there are efforts to ramp up the vaccine rollouts, Clement. We know that currently the country is able to vaccinate over 250,000 people per day, and the capacity currently that the country has is to definitely vaccinate over 300,000 per day, with more vaccination sites expected to go online and weekend hours and vaccination sites operating on weekends as well. But the big goal and target is for stadiums especially, and big venues. They're going to call them mass bulk vaccination sites to come online as of August, and they are expecting to then push up the number of vaccines administered to 400,000 by September. So the efforts are there. We just hope that the plans are implemented and we actually see vaccines administered as quickly as possible.
So the minister also talking about perhaps a tweaking in the strategy that the health department has used to vaccinate people. She seems to be, more interested in the strategy of let's focus on the ages, right, and not necessarily the industries. Why does she believe that's going to work? Because there have been some concerns that why are you not prioritizing people with comorbidities that may not be 50 plus, but actually they do have more comorbidities and are at more risk of contracting the virus and dying and even getting severe illness.
Yes, and this was a question that eNCA actually posed to the minister, to say that it's all good and well that you have started with the most vulnerable of the population, which is 60 and above, and you move over to 50 and above. But there are people that don't fall into the category of 35 to 49 to be vaccinated, and they are sitting with serious comorbidities, and should they contract COVID-19, there's a huge concern that there might be hospitalization or mortality. And the minister's saying that in the next coming days, Clements, they will most likely make an announcement with regards to the cohort 18 plus. She says that the majority of the population sits between the youth, and this is why they've decided that they will open up 18 plus and not 30 plus. So the big issue here, and the reason why government initially decided to open up specific age groups first, was because they believe that the older you are, the higher the chances are that you suffer from diabetes, or you have high blood pressure, or any other comorbidity that could put you at risk when contracting COVID-19. But the minister approaching a different strategy, saying that perhaps we should just open this up to more age groups so that we can cover those that aren't eligible currently to get vaccinated. And I think this is going to be critical, Clement, because we are seeing many people suffering and exposed and have comorbidities, but they're not eligible to get the vaccine that is said to protect from severe illness, hospitalization and death of COVID-19.
And do we still have enough supply of vaccines?
Yes, we do. We have the gold liquid, Clement. This is the good news. We do know that more vaccines are expected. This coming Sunday, we will be receiving another batch. If I'm not mistaken, it's just under 1 million Pfizer vaccines. And the current vaccines that we have, we try to get a number of the current Johnson & Johnson vaccines that we have that are expected to expire on the 8th of August. But we do understand that government will use those vaccines by the 8th, and we are expecting to receive more Johnson & Johnson vaccines in August. And of course, we get those Pfizer deliveries almost every Sunday. So the supply seems very good, and government is not too worried, and this is possibly why they have decided to open up more cohorts and categories, because there's an urgency to get as many people vaccinated as possible. And I just want to include an alarming and worrying stat that's released every single night. Currently, we have 17,000 people in hospital, public and private, due to COVID-19. So government needs to urgently reduce that number and prevent that from happening should there be another COVID-19 wave.